most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we have the best 3 foot drop tests and how to walk normal again. So this is after stroke or nerve damage or what else, Brad?
Right, you could just have weakness from an injury. You know, if you car accident maybe injured your legs in the
Neuropathy
yeah.
would do it too.
Oh, there you go.
Yeah, there's lots of ways you can get foot drop. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media channels and also our website, bobandbrad.com, because we're always giving something away. Not today, Saturday, but tomorrow. You go on Sunday.
Yep.
We're gonna be giving away a mattress.
Yes.
You want to sign up for that? Sleep version.
You say it, but I'm not going to sing that.
All right. If you want a shorter version of Bob and Brad, go to Twitter and Instagram. There we do like 1-minute versions of us, and we don't ramble on like this.
Did you say they can?
Yeah, they can go to Facebook too and sign up for
the giveaway
there.
The
too.
mattress.
It's always pinned at the top of the page. So.
All right, Bob. So we talked about the foot drop, you know, the common causes. And I don't know, I think I probably work with it most with stroke people, but I certainly have worked with it with people with a back injury.
My mom has it, and she had nerve damage from back injury.
Sure. Yeah. So if you think you have it, one of the tests is very simply when you're walking, if you find that foot, like your toe catches and you're stumbling, and you can't figure out why. I have a pair of shoes that does this. I'm pretty sure I don't have foot drop, but for some reason, I'll do that every now and then. But if you find your foot dropping or you're going to fall because your foot catches on the floor, that's a sign of foot drop. Then you should go to one of the next tests.
Well, it could also be a foot slapping.
Oh, sure. Good point.
You might hear a sound on one side, kind of making the sound of a slap on the floor.
It's just on one side.
Just on one side, right.
So I'm going to
demonstrate one of the tests?
Yep, the first one. And this is what tests that they use all the time. You go to the doctor, almost even at a general physical, they'll say, can you walk on your heels?
Yep.
And what they're looking for is anterior tib, which is L5. Is that correct?
Sure.
Yeah. One way or another, it is a test. Now, if you have foot drop, the strong leg, if your left leg is strong, it'll be fine. And this one will kind of fall. I've just worked with someone just like this. It couldn't hold that toe up. And that's a pretty positive sign.
Were they surprised? Or did they know it?
Well, there was a lot of other issues going on, so it was kind of...
Just a minor...
Yeah, it wasn't surprising to me.
Sure.
And I didn't, but...
I was just saying, because I had a patient who, I mean, he was a runner and he had foot drop and he didn't know it. I mean, it was really surprising to me.
Yeah, compensating very well.
Right, he was.
The third test is a simple manual.
The first test was hearing it,
or just watching someone, watching yourself. Yeah, is your foot dragging? Are you slapping? And then do the heel walk.
Sure.
And then number 3 is a manual muscle test that therapists are all familiar with, but it's simple enough. I think anybody could do this.
Have somebody, a friend or a partner here that's going to have to. You got some weird colored socks on.
I got to go to work, but I couldn't put my nice fancy ones on.
So you're going to have.
They're gargoyle. Look at that.
Argyle.
Okay.
All right. Okay. So we're going to go ahead. He's going to take his toe and bring it towards him.
Right. So I'm going to pull it up as hard as I can. And then I'm going to hold it.
And I'm just going to go and pull on it. And this is a strong muscle normally. So you can pull as hard as possible.
Right.
And if it holds, it's doing fine.
Right.
If you go like this and it gives way, there's a problem.
And it may be a partial thing. It may be not, they can't even do this. But they may be able to get it up. But when you pull, it breaks.
Yeah, it breaks.
Yeah.
Right.
And it should be equal on both sides.
Right. They're not able to hold it.
So between those 3 tests, I think, you got a fairly good, this is not one of those things where it's like, well, you have to be a therapist to figure it out.
Right.
It's pretty clear between those 3, I think, if you're positive on all 3.
And you might have some numbness and tingling along with it
too.
So.
Yeah, which would be indicative of nerve damage.
Sure.
So how are we going to treat this? We got to work on getting the anterior tib muscle right here. Get those socks out of the way. So I should have known better today. Anterior tib muscle that pulls that up, which is right there. There's a lot of different ways to treat it. As a matter of fact, I'm not going to go through a lot of them just one, because
Sure.
it's my favorite way to do it, particularly with stroke. We've got someone right now, he's had a stroke, and we're using it with him, and it gets him to walk normal so that he can walk normal. He doesn't compensate.
And you're hoping then that other parts of the brain will start kicking in and
Right,
helping out and learning to
right.
hold that foot up.
There are just strengthening exercises, and if you go, we've got a video just for anterior tib strengthening for foot drop, and it's called, if you Google Bob and Brad 10 exercises for foot drop, that specific video should come up, and you can view that. This is on there as well at the end of the video.
So he's got a big length of what we call TheraBand or
Mhm.
exercise band.
Yep. It
You
it
can
won't
buy
work
it.
very well with tubing. You should have the flat band.
Sure.
You could try it with the tubing, but it won't work on the
And you
foot
can
as
get
well.
this on Amazon.
Yes. Yep. You can get it in
exercise.
lengths.
Yeah,
You should get about 10-foot length.
Sure.
Because it needs to be about this long when it's slack. And you're going to take it like this, step on it in the middle on the forefoot, not on the heel, but it has to be over the forefoot, over the toes. Put a little stretch on it. Cross it once. Cross it twice. Works better if you cross it twice, and then get the cross down by your foot, as you can see them down there. And then, this is the hard part. Sometimes you may need help doing this, going behind your foot. You cross it behind the leg, actually about just below the knee level, and then you're going to make a cross in front over the quadriceps. And you're going to pull it not real tight, but snug. It should feel snug. And then from here, you cross it there. You got to go between your legs. Around here, oops, I'm sorry, we don't go between the legs, we go over the
Over the
hips.
leg,
Sorry
there you
about
go.
that. I'm a little nervous, it's my first time on camera. And then, so you can see what the back looks like. And you go around, and this is important that we get the pressure on the thighs, and if you can get this to come up over the hip a little bit, that can help give the hip flexors some indication to work. There we go. And don't tie this real tight like a big knot, because you got to get it undone.
Yeah, and it'll be difficult to get undone. You'll end up cutting it off. instead of-
Exactly.
so,
So what happens here is everything works together. It helps get the quadriceps going. As you step through, it pulls up the toe to help that dorsiflexion. And we have, like the gentleman we've worked with, he's really dragging his foot. We put this on him, and all of a sudden it's not perfectly normal, but about 80% improvement with this.
are you getting some help with your hip flexor too with this?
Yeah, I think so. It's probably not as much, but that's why you
Yeah, I
get
was
as
gonna
much as you
say.
can.
So what,
With-
what I'm saying is it helping lift the leg up like this, and Brad's saying yes.
Yes,
Okay, good,
yep.
Right.
Yeah,
So-
and this one is the key one for that coming up. That's why I want it over that pack
Over
as
the
much as
front part of
possible.
it, yeah.
Mhm.
So
So obviously you're not going to wear this all the time, but it's a good way to get started.
it's a good training tool.
Yep.
And yeah, again, remember safety first always on these things. Make sure if you're unstable, you have somebody has a belt on.
Right.
And,
Yep. Not doing this
so-
by yourself. So if you work this and you're working other exercises to strengthen that tib, and if you're doing it for probably 4 to 6 weeks and you're not gaining anything, and maybe longer than that, you may need to get an AFO.
Sure.
And typically a custom AFO, which means
ankle
ankle.
foot orthosis.
Right.
Yeah.
This is just a kind of a generic one, but this is actually custom fit. And they make them now. This is a little older, but they'll make them that don't look so
Right,
obvious.
bulky. They have some very sleek ones now.
Yep,
that look
carbon
actually-
fiber. They look
Yeah.
nice. You will have to get it probably custom fit. I don't know if you're going to find anything off the shelf.
Sometimes they're off the shelf and they make minor adjustments to them.
Sure. Yeah. Yeah. They're coming a long way. And I'm not going to go into too much detail for that.
But this is one that has a hinge on it
Yeah.
actually, and it's molded. It's for a larger person, as you
Right.
can see. But we used to actually just have people wear high top tennis shoes sometimes. And
Sure.
sometimes
Just
if
a
they
little
want-
support.
Yeah, if they're it's a minor foot drop. They
Yep.
can get away with that. But-
Exactly.
Or boots.
Right.
Cowboy boots.
Right.
Yeah. Do you own cowboy boots?
I did when I was 24. I went out and bought a pair. I was going to be the rhinestone cowboy or something like that, but it never worked out. One way or another, I didn't have foot drop with them.
Yippee-ki-yay. So thanks everybody for watching.
You
Does
bet.
you got anything else to say?
Well, Bob, once again, we can fix anything.
Except for a broken heart.
There you go.
We're working on it.